At Bronson, we understand that a level of mistrust exists in the Black community related to the COVID-19 vaccine. To answer some of the common questions and fears heard in the Black community, I'd like to welcome Dr. Richard Van Eyck, Director of Infection Prevention and Epidemiology, and Dr. Martinson Arnaud, Vice President and Clinical Officer for Bronson Medical Group. Thank you both for joining us today. Dr. Van Eyck, I'll start with you. As one of the most trusted and familiar faces our community sees representing Bronson, when there's a discussion around the COVID vaccine, what would you tell the person who believes the vaccine was rushed into production and might not be safe?
Yes, vaccines take time to develop. The technologies that we use to make vaccines take time, but this vaccine actually wasn't rushed as much as you might think. I can explain how the vaccine came to be, and that might help us understand it. The technology for the vaccine that we have is not new. It's new in humans, but it's been used in the laboratory for many years. It was discovered many, many years ago. And so it's not an untested technology. The application to this disease is new, but the technology is not new, and it's been known to work for a long time. The other issue is that it's only been a year since the virus was discovered, and we already have a vaccine. That seems fast. That's true, but that's because the different steps of the vaccine were done at the same time sometimes and overlapping rather than one by one and sequentially. So they were able to compress the time sequence of vaccine development, and that allowed the vaccine to come to market sooner than the typical vaccine. So the question is whether it's safe or not. And I think that the technology of this vaccine is very different than any other vaccine we've made, and it's extremely safe. One of the advantages of this technology is that it removes a lot of the contaminants and the problems associated with other vaccines. And so you have a pure vaccine now instead of a vaccine that has additional issues and side effects. So this is probably the safest and cleanest vaccine that we've ever made in the world.
Wow, thank you. Dr. Arnaud, as a physician who's researched the safety and efficacy of this vaccine and honoring the validated fears and concerns of the Black community as it relates to vaccines, is getting COVID-19 really that bad, and is the vaccine riskier?
Beatrice, thank you so much for this question. I think this question touches on a very important issue, and the issue of trust. I think that events that have happened in America recently speaks to the fact that some of our institutions get shaken, and we get shaken to our core, and we ask ourselves, can we trust what we are hearing on TV or from the so-called experts? And so I come to your audience today not as an agent of the government or an agent of the state. I come as a physician, a practicing physician, who cares very deeply about this community and my neighbors, and as a son of a reverend or a preacher, and hence I hold my integrity very dear to my heart. And so I can speak clearly and truthfully to the fact that I believe that this vaccine gives us an opportunity to be able to put this pandemic behind us. Touching on the issue of which is worse, getting the disease or the vaccine, I would say that although most people who might get infected by COVID might survive it, there are some who do not survive it, and it is difficult for you to determine which group you might be in. And being in the unlucky group that might not survive it has an impact not just on you, but all your loved ones, and perhaps some of the people that you might care for, that you take care of, who rely on you. And so that's a high risk to take. In addition to that, we have found that there is an aspect of COVID that a lot of people have been talking about. You may have heard about it, by the name of long COVID. That means people might have COVID and they'll continue to have symptoms for a long time, often symptoms that are affecting how their brain functions, like their memory, tiredness, forgetfulness, and all of these issues. And so when I think about all the devastation that this disease has wrought on people, both in terms of the community and as individuals, and I see that the science around how this vaccine was developed and its effectiveness, which has been shown to be extremely high, I can say confidently, as someone who has received the vaccine, that I think that we all do ourselves a huge favor by getting this vaccine so that we give ourselves an opportunity to avoid all the devastation that this disease can cause on you personally and also to your loved ones.
Thank you. Dr. Anna, one more thing. Does the vaccine actually contain the coronavirus? And if you receive the vaccine, will you get COVID-19?
That's a good question, and I think that that's one of the exciting new technology about how this vaccine was made that is worth touching on. It is called an mRNA vaccine, and I'm just going to explain how this is different. For the longest time, the way we have created vaccines is either we take the virus that is causing the problem, we weaken it, pretty much beat it black and blue, and then we give it to you. So it can't hurt you, but at least your immune system recognizes this beaten up, weakened virus and develops an immunity to it. Or sometimes we might take a subunit, a part of it, and again introduce it to the body. In this particular scenario, they used very unique technology that was developed as far back as 1990. It's when they started publishing papers about this. And basically got a genetic code of one narrow segment of the virus, which is pretty much a pointy spike that is on the head of that virus, and took that message. It's almost like giving a person a book to read. And so you give that message to your own cells and say, read this line. And your body reads it and says, this is the picture of the spike on the head of that virus. And that information is sufficient to make your own body create an immune response to fight the virus, so that if the real virus should come, your body is already ready because it saw a picture of what that virus could be. And so there is no viral component that is used in the development of this vaccine.
Oh, thank you for the response. I think that answers a lot of questions as it relates to contracting the virus from the vaccine. Dr. Vinny, there are a lot of wait and see or you go first people in our community. What are the dangers in that approach, and what would you say to change that mindset?
Yeah, I think it's understandable that people might think this is a brand new vaccine. It's never been given to humans anymore yet, and so maybe I don't want to be the first one. I would like somebody else to take it first, and then I'll find out what this vaccine does to see if it has any harm. That's a reasonable approach, but now we're beyond that. The vaccine's been given in Kalamazoo for 4 weeks now. It's been given, in other parts of the country for a long time. We have millions and millions of people who have taken this vaccine now, and so now we know what the vaccine does, and it's very safe. And so we have that experience, we have that observation, we know what people, how people respond, and they do just fine. And so I would say now is a good time to make your decision to get the vaccine, because you have all the information you need to make your decision. You know that it's safe and you know that it works. So let's make a decision and let's decide to take this vaccine when it's available.
A follow-up question to that is, after getting the vaccine, how long will people need to continue to wear masks, practice social distancing, washing their hands, continue to do those things. And the bonus question to that is, I guess, when will we get back to normal?
Yes, get back to normal. That's right. Everybody wants to get back to normal. That's absolutely true. It's a difficult question to answer because some of the answer depends on us and some depends on the virus. Some of you might be aware that there's a new strain of virus that arose in England, and it's here in the United States now, and it's spreading very fast. So that gives the virus an advantage. The vaccine will work against that strain, but that means that the virus will probably be here a little bit longer. The more people get the vaccine, and the sooner they get it, the sooner the virus will go away. So to some extent, how long the pandemic lasts depends on us. It's our decisions, our personal choices that we make that will make the vaccine go away or allow it to hang around. And so far, we've done a lot of things that allow it to hang around. We haven't socially distanced, we've gone to parties, we've gone to family gatherings, some people won't wear masks. So all those things allow the virus to hang around in our communities, and we don't want that. So the sooner we do the things to make the virus go away, the sooner the virus will not be able to find another susceptible person, and then it will leave.
So in a sense, the way we operate as a community, as an individual, we're our own saviors when it comes to accepting the vaccination and doing the proper things around it.
Exactly.
One last question, and this is a toss-up for either of you or for both of you, an opportunity to respond. There's a clear push to encourage people in the Black community to receive the COVID-19 vaccine. What effects of this virus have you seen in the Black community that compels you to keep that intentional focus?
I think one of the most unfortunate things that we learned as this virus was visited upon us was the disproportionate mortality rate among African Americans compared to other racial groups in the United States. And this was something that was seen in Michigan, seen in New York, seen all across the United States of America. And it is not because African Americans have weak genes. It's because there are systems in place that have put some people in this nation at a disadvantage. And so a virus such as this just exposes the disparities in care that have always existed. However, because that reality exists, that's why people such as myself, Dr. Van Enck, are so vigilant and persistent in making sure that all communities, including African American communities, have an opportunity to get this vaccine so that you might get a leg up against a disease that might disproportionately target you in terms of its impact on our communities. And so that is the driver, if you will, that makes us feel that we want communities that have been so devastated by this virus because of other structural issues that are in America to have an opportunity to get this vaccine so you can have a leg up over the vaccine.
Yeah, I can tell you we are very, very aware of the disparity between different communities, and we'll be very vigilant and aggressive about making sure that communities of color have great opportunities to get the vaccine in terms of access, getting into those communities, making sure that those people are talked to so that they understand their concerns are addressed, they understand what the issues are, we make it very easy to them, because frankly, they've been excluded for many years and often are, and so we need to address those issues. And the county and the hospitals are working very hard to achieve those goals.
As we wrap this up, Do you have any final things that you want to add to the conversation that we've had today?
I can start. I think basically, again, I would touch back on the issue of trust, that even though trust in our systems at some point might be shaken, we have to also trust in what America represents. It's really the land of freedom. It's the land of opportunity. And it's a land where amazing things have been accomplished as America led the way to the moon and also helped for us to really stand up this vaccine. We continue to set the pace for the world. And I think that it's incumbent upon us as citizens of America or people who live here to take advantage of these opportunities. And one of these opportunities is we have access to a vaccine. There are people in the world who are begging to have a chance, to have a shot. And so I think if you have an opportunity, you should take advantage of it. It is your, for lack of a better word, a God-given right as someone who lives in America, and your taxes are paid for it, so take advantage of it.
Yes, yes, we hate COVID. We hate it so much. It's been a terrible thing for us, for our communities. So many people we've lost because of COVID. We want it to go away. So now we have a tool to make it go away. So it's our responsibility to use that tool so that we can never have to deal with COVID again and we can get our lives back to normal again.
It's been such an honor to speak with the both of you, to have this conversation about the COVID vaccine and the effects and the importance of this, specifically for the Black community. Again, I just thank you so much for your time and questions. I know it's important for Bronson to have these acknowledgments and these conversations to improve on the trust that we have and can build in our communities. And that starts with leaders, with scientists, and with physicians like you. So thank you very much for your time today, and I really appreciated your conversation.
Thank you, Beatrice.
Thank you.